An Idaho mother and baby were able to reunite with a team of doctors in Utah who performed the state's first in utero fetal surgery. Local News 8's Rachel Fabi has more on the surgery performed with teams from Intermountain Primary Children's Hospital and the University of Utah.
We knew right away that termination was never, ever an option. She is my baby, and God gave me her for a reason.
Elisa Keyworth and little Abigail Rose made history a year ago in Utah when doctors performed the state's first in utero fetal surgery. Abigail was diagnosed with a severe case of spina bifida.
Getting that diagnosis was heartbreaking and shattering because I felt that I had done something wrong. And, we did our homework. Even before we met with Dr. Fenton, Dr. Bolo, Dr. Byrne, the neonatal team at the Utah Fetal Center, because you have this big conference to discuss options, choices, what you're gonna do. We met with the team, we went over exactly her diagnosis and what options best suit her.
The surgery Abigail needed is only available at a few hospitals nationwide, including the Utah Fetal Center.
We knew, even going into that if we qualified, yes, we were gonna do it, wherever that took us. Now, to be able to stay 4 hours from home was a lot easier than traveling to Texas or Philadelphia.
The procedure is performed by specially trained pediatric surgeons with extensive planning and care for mom and baby.
So we took her to the operating room and the mom was asleep, thankfully. Yes. And she was open so that we could expose the uterus and opened the uterus just enough to kind of put the back in position, so where the MMC was located. And then Dr. Bolo and his team, pediatric neurosurgery, actually closed the spina bifida, or closed the MMC. And then Dr. Byrne and myself, we closed the uterus and closed Alicia up, and she went to recovery and was delivered several weeks later.
Doctors say surgeries like this significantly increase the chance kids will walk.
That's durable benefit that's been shown even at 8, 9, 10, that if with fetal surgery, double the number of kids walk compared to having surgery after birth. So I think this is a great big milestone. Spina bifida is not a lethal condition in utero. Kids survive, and many of them we close after birth. But if we can get to it early, we could substantially improve the outcome and decrease the medical needs and improve the quality of life, mobility, and function.
Keyworth says Abigail has had some setbacks since her birth and will need follow-up care throughout her childhood, but for the most part is happy and doing well.
Yeah.
In Idaho Falls, I'm Rachel Fabi.